As Dr. Newell just reported, there is really good news in Santa Cruz County. The sacrifices and the challenges that our community has taken on have done a great deal in terms of positively impacting the increase of our cases to the point where our hospitalizations have flatlined and our new cases also have stagnated in terms of the numbers of new cases each day over the last 2 weeks or so. These are the numbers that we're really looking at in terms of how do we start coexisting with COVID-19. So many of you have heard, and I've talked about the governor's 6 indicators for California. And we knew that at the local level, I often say all public health is at the end of the day local. And so we have our own plan to align with both the federal and the state indicators for reopening our society during COVID-19. And I don't say after, I say during, because we're just in the very beginning of a long haul. Our effort is called Save Lives Santa Cruz County, and it's our way of navigating California's COVID-19 resiliency roadmap, which the governor released last week. So California's 6 indicators for modifying our stay-at-home orders are to monitor and protect through testing, contact tracing, isolation and quarantine, and supporting those who have been tested positive or exposed. Prevent infection in people who are at risk for more severe disease, making sure our healthcare system is prepared, having treatments or even a vaccination and having them widely available to meet demand, having our society, businesses, schools, government, childcare facilities ready with plans to support continued social distancing, and also the ability to determine when we might have to go back and forth with different levels of social distancing and shelter-in-place orders. So the way that we have decided to capture this is to align the work that we do in the county in 4 phases to reach elements of the state's indicators. And we call our effort Save Lives Santa Cruz County. The S is for phase 1. Phase 1 is slowing the spread. A stands for adapting to a new normal for a length of time, which we think will be about 18 to 24 months. Phase 3 is when we have a vaccine and therapeutics widely available so that we don't have to rely on shelter-in-place orders and testing and contact tracing. And then phase 4 is elevating our readiness. Whenever we have an emergency, we should learn from the lessons rather than move on and think that this is over and prepare ourselves for the next emergency. So in phase 1, we're strongly set in that phase right now. We've put in place physical distancing measures, and we're working really, really hard to expand public health testing, case investigation, contact tracing, isolation and quarantine, and supporting that. We're also expanding our healthcare bed capacity and personal preparedness equipment availability. One of the things that we've done is our Public Health Department Operations Center, they have several branches, and the biggest branch is our operations branch. So that branch recently added another section to it called Community Recovery. And that Community Recovery branch will be wholly responsible for Save Lives Santa Cruz. One of the things that we did is we recently acquired Margaret Lapise, who's a very well-respected innovator and advocate for health equity. And she will be helping us develop this in partnership with our local community stakeholders, government, as well as neighbor counties such as Monterey County. So we're very excited to have her with us, and she's on loan to us from the Santa Cruz Community Foundation. And we believe that having someone directing this effort is going to help us be successful and also help implement these phases very quickly. The next phase is adapting to a new normal. So phase 2, adapting, means that because we have done a good job of increasing testing, ability to contact trace, and our healthcare capacity, we're finally able to modify some physical distancing measures for businesses, schools, and childcare communities. I know that there are a lot of letters that were provided to the board in the last couple of weeks about reopening our economy, and I have empathy for every facet of our community, from our businesses to the families and the individuals affected. I do want to say that these modifications that we're entertaining, when we get to, are based on data about the disease progress in our community, data about our ability to control and address the spread of disease. And so when we're in this long phase of adapting to a new normal until we have treatments or vaccine, we're going to maintain and possibly expand if needed our testing and contact tracing abilities, and then also our public health and healthcare capacities and infrastructure. So phase 3, it's not something that we have any control over as a county, developing a vaccine or therapeutics, but the public health and the local jurisdiction role, when we do have those, is to be able to know that while we're in phase 2, we're working on a way and a plan across our community to work with our clinic partners and our hospital partners to make sure that we have a plan to quickly disseminate vaccine, first and foremost, to those most at risk. We also need to have a plan in place for mass dispensing of any medications that are developed, and make sure that we continue to have these public and private partnerships so that we can respond in this new phase of the event. And then finally, phase 4 is elevating our readiness for the next public health emergency. And again, not forgetting the lessons learned from addressing COVID. There are 3 data-driven criteria to modifying the shelter-in-place orders across these phases. And I think it's important for your board, as well as those we serve, to understand that modifying orders is not based on how long we've been sheltering in place or on a certain date. It's based on our capacity to keep our community safe. And the 3 buckets of those data that we're looking at are epidemiology and surveillance, healthcare, and public health. So in terms of epi and surveillance, we're looking at these broad things, and we do have internal indicators to tell us when we're going to get there. We're looking in general at continued decreasing cases, continued ability to increase our testing capacity, which is actually happening right now. I can't recall if Dr. Newell talked about it, but in terms of testing capacity, the state has sponsored a community testing site for us that is hoped to be operational as soon as next week, and it will be located in South County so that we can better serve the Pajaro Valley. On top of that, we have access to a new testing site at UC San Francisco, and we're also working with some local academic partners on another new lab in the county. Decreased death rate. We have held still at 2 deaths for quite some time in Santa Cruz County, and I think that's a testament to the good work of the entire community. And we're also looking at a decrease in influenza-like illness, so all of those symptoms that come along with colds and flus and COVID. In terms of healthcare, we're looking at having more discharges than we have admissions for COVID-19, making sure that we have the staff capacity to address any increases. What we do know and what we expect is when we start modifying aspects of shelter in place, we will have more cases. And it's not cause for alarm, but it's cause for preparedness. We're also working on sufficient PPE, personal protective equipment, for our healthcare workers, and that situation continues to improve weekly, and it gives us great insight, and we feel like we're on the road towards modifying elements of these orders. And as Dr. Newell said, and as our governor said, the modification will take place over a series of weeks and months. It's not going to be flipping a switch and opening the economy, but we are looking at what we can open in a phase style while we're still managing control of the disease. In terms of public health, we want to make sure that our public health system has enough contact tracing capacity for all positive cases. That's one of the biggest charges of our community recovery branch and our on-loan consultant, Margaret Lapise. We're working on increasing isolation options for those people who are positive. One of the things that has already launched is that California has sponsored something called Hotel for Healthcare. So we have let every provider in our community know that if they're working as a healthcare provider in Santa Cruz County, there are local hotel options available to them at very low or no cost, coordinated through the state. And the only requirements are that you're currently working as a healthcare provider and that you either are exposed to or have potential exposure or known exposure to COVID patients. And it's just our way of working with the state to ensure that those on the front lines working in healthcare are able to keep their family safe without incurring extra costs. Finally, on the public health side, we need partnerships to support physical distancing recommendations. Those are the things we're preparing right now. And also a regional approach to our shelter-in-place strategies. And we are working on that right now. I think it's clear when you look at Santa Cruz County, we don't live in a bubble. There are folks who come here from the north, from the south, from the Central Valley, and what happens around us impacts our communities as well. So we're working really hard with our regional and state partners to ensure that what we implement here in the county is well supported by those around us. And so I'm pleased to talk about the planning work that we're doing, and that we've put a lot of effort and time and thought into how we coexist with COVID for the next several months, rather than be in a continual state of what feels like a battle for the last several weeks. Thank you.